Good evening. My name is Kenesha Wooten Caldwell, and today I will be speaking with you about seeking help with paying out-of-pocket healthcare expenses. Due to the significant increase in unemployment over the past year, more and more individuals are no longer able to afford healthcare premiums for themselves or their families. Hopefully today I can provide you with a few tips to help reduce the cost of out-of-pocket expenses. You don't always have to pay retail. If your health insurance isn't covering your needs or you lack insurance, you can probably pay less for elective and planned procedures by just speaking up. People often don't realize medical bills tend to be eminently negotiable. The first thing is to know the real cost. Arming yourself with price range information will give you a reasonable number to use when starting a discussion. Check your insurance carrier's website. Most major carriers let members see their negotiated rates. Sites such as Healthcare Blue Book, Vimo, spelled V-I-M-O, and New Choice Health also make it easier to figure out the actual cost than it has been in the past. With a few mouse clicks, you can get an idea of how much your local hospitals and doctors charge, plus how large a discount the average insurer would receive. The Healthcare Blue Book lists fair prices for self-pay patients, defining fair as a small premium above the average fee local providers accept as payment from insurers. Use the right words. Once you have price and references points, but before you've committed to the procedure, visit the billing person in the doctor's office or the manager of patient accounts at the hospital. This way you can attempt to negotiate a discount before receiving treatment. Then be clear and confident. Say something like, "These bills are very, very high. Would you consider adjusting the price to be more affordable?" Or, "My insurance carrier is not covering this treatment, so I'm paying for my own care and would like to see if you can lower the price." Making things personal may help. If you've chosen a particular doctor because you've heard glowing recommendations from friends, mention that. If you've recently been laid off, say so. The billing staff may be willing to cut you a break. In a hospital, ask whether you qualify for any financial assistance programs. These are not just for poor people. Someone who earns $100,000 a year but has a $50,000 medical bill might just qualify. Ask about going outpatient. Some types of surgery scheduled for a hospital with an overnight stay can be performed equally well at a less expensive outpatient center. Number 4, negotiate afterwards. If you've already had the procedure and staggering bills are arriving, you can still ask for a discount. Hospital billing departments are often eager to collect something and get the charges off their books rather than deal with lengthy collecting processes. Start with an aggressive offer. For example, "If I pay you 30% of this bill right now, will you write off the rest?" Even if your initial offer is rejected, the hospital may counter with a discount you can live with. In a hospital, if you are offered a 10 or 20% discount, press on. That is not a big reduction compared with the markup they are probably charging. Go up the chain of command, calling the billing manager or the vice president of finance, and so on, building a relationship with each and every one of these individuals. Write down their name, their title, their contact information, the date and time you spoke with them, what they said to you, and if you reach an agreement, make sure by all means to get it in writing. Now, number 5 is very important because America is caught up in plastic. Don't pay by credit card. Forgo the credit card if you think you might be asking for a discount later. Using plastic reduces your bargaining position with the hospital. Inquire about a payment plan. If you are still facing a huge bill after negotiating a discount, ask for an interest-free payment plan. This strategy leaves you with the option to renegotiate the amount later on down the road. After demonstrating good faith by making timely payments, you can then write to the billing office. "I've been faithfully paying this bill for a year and a half." Remind the office of the total you've paid to date. And say something like, "My family is having a tough time during this economic crisis. Will you forgive the rest of the bill?" Now, if all else fails, call in a pro. If the hospital or doctor won't give you a break and your medical bills are out of control, enlist the help of a nonprofit or professional advocate that can help bargain for you. Medical Billing Advocates of America. Take your time and write that down. Has specialists who typically keep a percentage of the reduction they negotiate for you, perhaps a third. The Access Advocates Project provides free one-on-one coaching, including negotiating with doctors and hospitals. You can fill out an online form, and a staffer will call you back. For self-pay patients, most facilities offer up to 40% discount for the services. No matter how big or small your bill may seem, there are only two answers an individual in life may give you, and that is yes or no. So next time you or your family member become ill, do not hesitate to receive care, for there are ways to avoid or reduce medical costs. Just follow the self-help tips I have provided for you, and the reduction in out-of-pocket costs is guaranteed.